Do psych nurses lose their skills? For me personally, no, I did not lose my skills because I never actually had them to begin with. I went straight into psych right after nursing school, and I never really feel like I had medical skills. I mean, we had to get checked off on like inserting NG tubes, Foley's, stuff like that, but I didn't do it enough. Even IVs, I didn't do all that stuff enough to where I really felt that comfortable with it. So I never really lost my skills. At the same time, I never really had those skills to begin with. But if I had gone into, say, med surg, learned a bunch of skills, and then I came into psych nursing, I feel like all those medical skills are like any other skills. If you don't use them, you just end up losing them. And so I definitely think going into psych nursing, you lose skills, which isn't to say that psych nurses don't have skills. We do. I think our skill set is just a lot different than what a medical nurse uses. And I've certainly seen nurses who are strictly medical come into a psych field and they're just like, sweet mother of God, and they kind of panic, they freeze, they don't know what to do. But I feel like the skills that we use in psych nursing are just so much different than like medical nursing skills that I don't want to say that I don't consider it nursing, but I kind of don't really consider it nursing. It's just really like people skills and using people skills. And eventually, I mean, you'll do, like I do blood pressures on a regular basis, med passes frequently. You'll learn to sort of assess psychosis and try. I think the hard part about psych nursing is really trying to figure out what's going on with a patient when they can't communicate it to you clearly. But if I had to go into like med surg, I'm pretty sure that I would end up killing somebody inadvertently because I just wouldn't know what to do. I mean, not really. I wouldn't kill somebody, right? I would ask questions and stuff like that, but I would feel completely incompetent, put it that way. At the same time, for those of you out there who are like, man, my heart's really set on psych, but I don't want to lose my skills, then go to psych. Just do psych. You can do psych, and if you end up not liking psych, it's not going to be the end of the world. If I wanted to, I could easily go into a medical place. They'd have to put me through some training for a while, but in a few months, I'd feel fine. In fact, I had a boss that worked with me and he was in psych for probably 8 years working in psych. I don't even know if I think he went straight into psych, had been into psych for maybe 8 or 10 years. And then eventually he was like, you know what, I want to change it up. So he went to a hospital, worked in a local hospital, did fine. And of course, at the beginning, there's a pretty strong learning curve, but if your heart's set on psych, then definitely go psych. Another nurse I worked with once said that she thought psych was harder than the medical field. She came from ICU, had a long history in working in the ICU. She felt like psych was harder because when it came to ascertaining what was going on with the patient, sometimes it's just super hard. I mean, a patient might be in severe physical pain, but because of their psychosis, it's so hard for them to communicate that. So sometimes trying to figure out what's going on can be very difficult. At the same time, me personally, I mean, just with my own skills, I'm like, bro, I don't have any skills relative to medical nurses. At least that's the way I feel. In reality, when it comes to psychiatric emergency, I feel like I can handle it probably a lot better than nurses who have never had any sort of experience handling a psychiatric emergency. But when it comes to psych nurses in general, I mean, I sort of like, if there is such a thing as a totem pole to nurses, I mean, I put us like probably towards the bottom. And that isn't to say that I don't respect what we do, because what we do is very important. It's just as far as skills go, we just like hands-on physical, like what are your objective skills? I think they're very difficult to measure, and they're not as apparent as, say, a medical nurse. Hopefully you found this video helpful, and I hope that answers your question about psych nurses losing their skills.